All right, let's jump right in. Today, we're going to tackle a topic that can feel really complicated and honestly a little scary, seizures. But our whole goal here is to demystify it, to break it down so it all makes sense.
So, to get us started, I want you to picture this image: an electrical storm happening inside the brain. It's such a powerful way to think about it, but what does that actually mean, medically speaking?
Well, it's pretty much exactly what it sounds like. A seizure is this sudden, chaotic burst of electrical signals firing between the brain's nerve cells. You can think of it like a temporary short circuit, a power surge that just scrambles the brain's normal operations for a short time. Okay, so this is where it gets super interesting. Not all of these electrical storms are the same. They're broken down into two main categories based on where they start. If that storm kicks off in just one specific spot, that's a focal seizure. And because it's localized, the symptoms might just affect one arm or one leg. But if the storm ignites across both sides of the brain at the same time, that's a generalized seizure. And that's when you can see effects on the whole body. This difference is absolutely key to understanding everything else. And that idea of different starting points brings us to maybe the most important point of all. Seizures can look wildly different from one another. There is no one-size-fits-all description. Let's just look at four common types to see what I mean. You've got the tonic-clonic seizure, which is what most people picture. The body stiffens, then they're shaking, and the person is usually really sleepy afterward. But on the complete other end of the spectrum, you have an absent seizure. This can be so subtle, it just looks like a child is spacing out for a few seconds, and then they're right back to normal. Then you have myoclonic seizures. These are just sudden, quick little jerks. And atonic seizures, which are the exact opposite, a sudden loss of all muscle tone, what people sometimes call a drop attack. It just shows you how huge the range of experiences can be. And this is so important, especially for parents or anyone around babies. In infants, seizures might not be dramatic at all. They can be incredibly subtle, just some brief, jittery movements or a weird motion that you might even dismiss. It's a huge reminder that what we see in the movies is not the whole story.
So, of course, the big question is, why? Why does this happen? Well, finding the cause is kind of like solving a puzzle. A seizure isn't the problem itself, it's a symptom. It's a clue that something else is going on, and doctors have to become detectives to figure out the trigger.
This brings us to a really critical idea in medicine. Epilepsy, which is a condition where someone has recurring seizures, is what's often called a diagnosis of exclusion. What that means is doctors have to rule out a whole checklist of other possible causes first before they can even consider that diagnosis. So, what's on that checklist? Well, one of the biggest categories is infections. Anything that irritates the brain, like meningitis or encephalitis, can absolutely trigger a seizure. And this category also includes febrile seizures, which you see a lot in young kids and are tied directly to having a high fever. Sometimes the cause is literally built into the brain's physical structure. It could be from an injury that happened during birth, a condition where the brain just didn't form in a typical way, or even a problem with a medical device, like a shunt. And then there's the brain's chemistry. Our brain is super picky about its environment. It needs just the right balance of things like sugar, salt, and calcium to work properly. When those levels get seriously out of balance, especially when they drop too low, it can make the brain's wiring go haywire. And the list of potential triggers just keeps going. We're talking head trauma, bleeding in the brain, exposure to certain toxins or drugs, even brain tumors. You can start to see why the diagnostic process has to be so incredibly thorough. They have to cast a really wide net. Now we're going to shift gears to something that is just as important as knowing what a seizure is, and that's knowing what a seizure isn't. We have to talk about seizure mimics. So let me just ask the question straight up. If you see something that looks like a seizure, does that automatically mean it is a seizure? And the answer is a huge, definite no. The list of things that can look like a seizure is actually pretty long. And a lot of them are really common, especially in kids. We're talking about things like breath-holding spells, fainting, night terrors, even an exaggerated startle reflex in a baby. All of these can be mistaken for seizures, but they have completely different causes.
Here's a perfect side-by-side. An absent seizure, that spacing out one, and a classic breath-holding spell can both make a child seem unresponsive. But the context, the story around the event is everything. A breath-holding spell almost always has a trigger, like the child gets upset and starts crying first. An absent seizure just happens, out of the blue. Knowing these little details makes all the difference. Okay, we have covered a ton of ground. So let's just boil it all down to the most important things you need to remember. What are the big takeaways here? First, let's keep some perspective. Those febrile seizures, the ones that are linked to a fever, are actually really common. They can affect up to 10% of children. So while they're definitely scary to see, it's a known thing that happens. And that brings us to the single biggest idea of this whole explainer. A seizure is not a diagnosis in itself. It is a symptom. It's the tip of the iceberg, a sign that points to this huge range of possible things going on underneath the surface. So I want to leave you with this thought. If we stop thinking of a seizure as the problem and start thinking of it as a message, a signal from the body, it changes everything. And it leads us to the much more important question: what is the brain trying to tell us?